2. All right, and we are live. We're going live. All right, and it's Hump Day with Dr. Alex Earl, and today we have Dr. Vidal.
Hey guys.
She's here, and we are all super excited because, as you all know, we're posting it everywhere, but Dr. Vidal is now double board certified. Yes, she's a board certified plastic surgeon. So now we have 2 double board certified plastic surgeons here at Pure. And today we have one of the most important hump days that we do every year. I do this at the end of every year. Now Dr. Vidal, she's going to join us because she's completed, well, she's gone over a year now, but it's the first last hump day where you've had a full year.
Yes.
So she's here as well. And at the end of every year, what we do here at Pure is that we go over our BBL stats. All right, so we give you the real numbers. What actually happened at Pure Plastic Surgery regarding BBLs for 2022. Okay, so these are the real stats, and we're going to compare them to the national average. So you may think, how do we get the numbers for the national average? Well, we get that through, of course, different studies, different research. We get the numbers through the American Society of Plastic Surgeons, which we're both members. And we also get numbers through WAGS, so the World Association of Gluteal Surgeons, of which I am the president, and Dr. Vidal is an esteemed member. Okay? All right, so let's go into it. We're going to talk about the stats. If you have any questions in between there, we'll be happy to answer them. And then, of course, once we're done with this, we'll be happy to answer any other questions that you may have. Okay? So, first of all, what are we talking about? What are the numbers? That, how many BBLs did we do? So, in 2022, we did a total of 648 BBLs here at Pure. 648 BBLs here at Pure. I did 443, and Dr. Vidal, 205. All right, 205 for Dr. Vidal, 443 for me, for a grand total of 648 BBLs here at Pure. And that's where we're getting our numbers from. Okay, these are the BBLs that were done in 2022. All right, take it away. Number 1.
That's a lot of BBLs.
Yeah.
So let's talk about fat retention. So what does that mean? All the fat that we move from the liposuction in terms of the abdomen, flanks, back, and we transfer it to the hips and buttock, fortunately does not survive all, because all of the fat needs to establish new blood vessels and grow in the new areas. So how much of that fat survives is what it's called fat retention or fat survival. In general, or in studies, it's reported to be around 50%. So half of what you put, half stays there. But in here at Pure, Dr. Earl and my patients, we've seen a retention of 70%. So it's very good. It's above average. And I think it has to do a lot with the time that we spend educating our patients and the importance of 3 main things. One is avoiding pressure to the grafted areas. Our protocol is to not sit and not put pressure to the fat grafted areas for 6 weeks. And especially the first 2 weeks is extremely important. Those first 2 weeks, it's when the majority of the new blood vessels are developing, and a lot of the swelling, it's there. So we tell the patients to try to avoid using the BBL pillow for those 2 weeks. Start using it after the first 2 weeks. The only exception, of course, is a flight back home if you're traveling, because you'll have to sit for that. The other thing is your nutrition afterwards. So it's very important to stay in your weight, to maintain your weight, and to prioritize healthy fats to try to keep the majority of the fat. And the third one is maintaining your lifestyle after surgery, diet and exercise, that combination to maintain your results long term.
That's exactly right. So that's what I wrote right here. So minimizing pressure, and of course your diet, your nutrition, extremely important in fat retention. Okay, that's why we go a lot into the details about that, and we've done, both of us, we've done several lives regarding that issue. Okay. Next, we're going to talk about revision rate. Okay, so there is a revision rate to the BBL. So one of the things that I love about the BBL is that it's, I think, a very powerful procedure. We can greatly change a body with the use of the combination of the liposuction, removing fat from places we don't want, and the fat transfer, adding places to where we do want, okay? So it's a very powerful procedure, but some of the downsides of the BBL is that it's not completely predictable, right? Nothing in medicine is 100% or 0%. And so the fat, it may not take the same rate in every specific location. We may lose a little bit more fat in one place as opposed to another. And there's also so many variables that are involved, right? No two patients are alike. So it's all, what about their genetics? How compliant they were post-op, the quality of the skin, the quality of the fat. So all these things play a role, which makes the surgery, not 100% predictable, and therefore there is going to be a rate of revision. Now, the average or the national kind of revision rate is about 10 to 15%. And for 2022, we did very, very well. So we have a revision rate of only 5%, which I think is great. And what I think that makes the biggest difference there, of course, there's surgical technique and all these things and trying to get as much fat to survive. So if you got more fat survival, then you can be a little bit more predictable, right? But I think the main thing here is also has a lot to do with, again, patient education and setting realistic expectations, right? So if the patient knows beforehand, this is what we're able to do, this is what we can't do, this is your realistic expectation, then they're a lot happier in the end, and they're a lot more accepting of their results, knowing that that's the best that they could achieve, and having a realistic expectation there. So revision rate, 5%.
Round 2, there is a lot of people that want to have a round 2 after a BBL. The majority of the patients that want to have a round 2 is basically to add more projection or shaping to either the hips or buttocks. And we are in average with what it's nationwide, the percentage nationwide, which is 15%. This has to do a lot with, again, the projection. So there's a limit of how much projection we can achieve in only one round. And the reason for that is because we are injecting the fat in the subcutaneous space and not in the muscle. Because if we inject in the muscle, it makes it very dangerous with fat embolism as a risk there. So the skin has a certain ability to stretch, and when it reaches that maximum ability to stretch, we can inject more, because then we are compromising shape. If the skin doesn't expand anymore, then it'll start to go up and down and create a shape that we don't want, a boxy shape or a more higher hip. So there's a limit to that, and if you do want more projection, then you can come back to a second round, another round of liposuction, and we can then, now that the skin has been stretched, put more fat in that area and achieve that more projection for you.
That's right. And another thing that we're seeing a lot of, and it's not technically considered a round 2, we're seeing a lot of people coming back for BBL, quote unquote BBL reversals. So we're seeing that as an upward trend. We're seeing an upward tick in that. So patients that have had BBLs, not necessarily from us, actually most of them from other places, and they're coming because they want to either kind of try to reduce things or change their shape. So back in the day, maybe 10 years ago, maybe there was a lot of like what we call like shelfie booties or high lats, and that's kind of fallen out of favor a little bit now. So a lot of patients want to come back and get more of that enhanced natural shape, which means more like that upside down heart, not so much lats and less of a shelf. And so we are able to, in many cases, change that shape back. And then also, if the fat in the first round was placed in that subcutaneous space, then we are able to reduce it. Okay. Now here's the thing: if that fat was placed, in the muscle or deep to the muscle, then unfortunately we can't reduce that. Okay, it would be way too dangerous to do it. You definitely don't want to be in that space. Okay, it's a dangerous spot to be, and so we won't be able to do that there. Okay, so big trend. Probably for next year, we'll probably even put its own category. How many people came in for BBL reversal that year? Okay. All right, but the next thing on the board here is infection. This I am super proud of. This is the best we have ever had. The best we have ever had, 2022, 1% infection rate. That's actually pretty incredible. Okay, the national average is 10%. 10%. Okay, why is that? Well, it's basically because of the location that we're working at, right? I mean, we can't mince words. We can't put it any other way. We're working near the anus. There's a lot of bacteria there. So there's going to be an infection rate there, okay? And that's why the national average is about 10%. But we've been able to reduce that quite significantly because all the things that we do here to minimize the risk of infection. So what is it that we do? So, okay, number one, we're still using that ultraviolet light. So we started doing that, during COVID. We did it initially because we wanted to get rid of viruses in the air. But it turns out that it's reduced our infection rate drastically. So we use the UV light right before we get the case started, okay? Then, of course, we do the liposuction, but before we then go and do the fat transfer, we re-prep the patient with a betadine solution. We use a betadine soaked lap right over the anal area as well to kind of isolate that as best as we can. And then we give the patient gets IV antibiotics during the surgery, and then we put antibiotics into the fat before we transfer it. It's actually the only thing that we do to quote unquote prepare the fat. We don't do anything else other than that. We don't wash it, we don't centrifuge it, but we do put antibiotics into the fat. And then that gets done before we do the fat transfer, and then all of our patients are on oral antibiotics for a week after surgery. And then basically the combination of doing all those things, we've been able to bring our infection rate lower and lower and lower. We started probably somewhere around, close to national average, just a little bit below. It was probably like between 6 and 8%, and then it's been creeping down all the way down to 1%. And quite honestly, I think that's about as low as we're going to get. I don't think we can get any lower than that. So our goal now is not going to be to lower this any further, because I don't think it can be done, but is to maintain that as best we can.
Awesome. That's an awesome number. Very, very, very proud of us to achieve that. And let's talk about the ultrasound. So national average here in Florida, we saw a lot of surgeons started using the ultrasound with the regulation, but once that stopped a couple of months ago, some surgeons decided to stop using it, others decided to continue. But here, Dr. Earl has used it since 2019. I started Pure August of last year, and I've used it in every single case. We've used it 100% of the time. So all of the patients that come for BBL here at Pure will have the fat transfer visualized in the subcutaneous space safely to avoid fat embolism with most of us. So that is 100% for us.
That's right. That's incredibly important. I think it's a huge differentiator. We've been doing this way before the emergency order came in. The emergency order unfortunately expired, and that doesn't mean, of course, that we stop. We continue using it for 100% of our patients. So all of our BBLs are done under ultrasound guidance. Which leads to the next one here, which of course is what BBL mortality. So as many of you know, there's still a lot of press, a lot of things going on in social media, a lot of still claims that this is like the most dangerous cosmetic surgery out there, and a lot of that data is actually outdated. So outdated data. So yes, it is true that before 2017. The mortality rate for the BBL was thought to be about 1 in 3,000. Which is way too high. And then there were many changes done around that time where the fat was, the guidelines were to place the fat in that subcutaneous space, which is that safe space between the muscle and the skin. There were also other guidelines into like how you position the patient, the angulation of the cannula, the thickness of the cannula, 4 millimeters or more, and have to have a blunt tip, etc., etc. And a lot of those changes then led to a decrease in mortality. And there was a follow-up study done 2 years later in which the mortality rate decreased all the way down to 1 in 15,000, which is actually very, very similar to a tummy tuck. So now they're on par. So now, it's not the most dangerous aesthetic procedure out there. It's very similar to a tummy tuck. Now, having said that, you have to go to the right place. You have to go to the right person. Okay, this study was done with board-certified plastic surgeons that knew about these guidelines. Okay, so that's the key there. So if you're going to the right place, you got to make sure they have a lot of experience and they know what they're doing and that they're following these guidelines. Okay, but here we take it a step further. Like we just said, we're using the ultrasound. We use that for 100% of our patients, and of course, we've had no issues with fat embolism and zero mortality regarding BBLs here at Pure. Okay, and that's a key difference right there. All right, so once again, great stats. I think this has been awesome. This was a little, actually even maybe a little unexpected, but we've gotten that pretty much as low as we're gonna get, and we just hope to continue that moving forward. And of course, moving forward, every single patient is gonna get the ultrasound as well. All right, so now we'll open it up to the floor. We're happy to answer any questions regarding this or any plastic surgery questions you may have.
together. Closer? Yeah.
Closer.
All right.
Now I can stand in front of the numbers.
Yes, of course. Can a tummy tuck, back roll, lipo, and breast lift be done at the same time?
Unfortunately, I don't combine the back with the mommy makeover. The reason for that is the mommy makeover is already a longer procedure, and if we are flipping you under anesthesia, makes that time under anesthesia longer. And also, we have a limit of 1 liter of fat removal when we're combining surgeries. And because I do, and Dr. Earl as well, the liposuction in the flanks, which is like the waist area, that is usually a max of 1 liter removal. So it's better if you want to have the back rolls removed, it's better to come back afterwards for a 360 lipo and cinch everything in, and then round up all the good result and the good shape on the torso.
That's right.
After a tummy tuck is needed, like lymphatic massages.
So we do recommend some massage after a tummy tuck. It's not as intense after, say, Lipo 360 and BBL, but we want you to massage the areas where you do the liposuction, which is mainly the flanks and the waist, to help with that. But also, you're going to get massage to your lower back. Now, you're going to be thinking, well, why the lower back? Dr. Riddell just said we're not touching the lower back. Well, it's not because we did lipo or any surgery to the area, but it's because after a tummy tuck, you're going to be walking kind of hunched over, and you start to develop a little bit of spasming, a little bit of pain to the lower back area. So the massages help a lot in terms of relieving that spasm and helping those muscles out. So we definitely recommend the massage. You can start as soon as the next day. The initial massages are just going to be in the flanks and in the lower back. They should not be massaging the front belly area. Okay? Do not massage the front belly area until at least 2 weeks post-op to give some initial healing time.
If I want a BBL, can some of my fat be added to my thighs for a more natural look?
For in a BBL, so yeah, I always put, and Dr. Earl as well, put a little bit of fat in the transition between the hip and the thigh, and also in the upper thigh posteriorly. That is gonna create, like you said, that harmony between the hip and transitioning to the thighs. So it's not matching the thigh volume with the hip volume. It's better to create a smooth transition between the two units.
Yeah, that's right. But to be clear though, we're not fat grafting the entire thigh, right? So if you're looking to have like thicker thighs, that's really not what it's about. It's just about making those transitions smooth.
Can Lipo 360 give a significant change in the way your body looks?
Yeah, of course. I think Lipo 360 is a very powerful procedure. So nowadays, no one does, or I don't know, I shouldn't say no one, but most surgeons don't do simply liposuction, which is just simply, fat or volume removal. We do what we call liposculpture, meaning that we're removing, the fat with intention to create a more beautiful shape to the body. Okay, and that's really what liposuction is. So it's not a weight loss surgery. It's not necessarily strictly only a fat removal surgery, but it's a body contouring or a body sculpting surgery. And Lipo 360 is very, very powerful. And if you want to take that notch even higher to another level of power, to power level 10, if you will, then you add the fat transfer, because then you can reduce the fat in the places you don't want and add the fat to the places you do want for very, very significant changes in shape.
Why do you do BBL separate from tummy tuck or any other procedure?
Yes, that's a very common question we get, and there's a couple of reasons why we don't combine them. One is safety, okay? I think combining all of those procedures takes the OR time too long, so the time under anesthesia is going to be too long, and whenever the time under anesthesia is long, the risk of complication increases. The second one is the recovery, okay? For a BBL, to optimize the results on the buttock, I'm going to ask you to be sleeping in your belly to avoid pressure in your buttock. And then for the tummy tuck, I'm going to ask you the opposite. So I'm going to ask you to be sitting with the hip flex, so you are not putting tension on the incisions and you are sleeping a little bit hunched over. So combining those two and the recovery of both and trying to optimize the results of both, I don't see how you can do it maximizing both of the results. And the third one is the regulation by the state of Florida of when we're combining procedures, we have a limit of fat to be removed to 1 liter, and that's not going to be enough to give you a good sculpting and to have a good transfer so you can see a good result.
Yeah, and that comes back to number one here, right? So if you do the combination, then by definition, you're gonna have to be basically on your buttock and your hips to a certain degree, even if you use a cutout or whatever. So that means you're gonna have more pressure, so that fat retention rate's gonna go down.
Can you get a lift without silicone at the same time a tummy tuck?
So you can definitely do a breast lift without implants for sure, and you can combine that with a tummy tuck. So that's still a mommy makeover. And yeah, I mean the whether you want an implant or not depends on on the patient, and it also depends a little bit on how much breast tissue you have, right? So if you have a certain amount of breast tissue, that's better because all we have to do then is just rearrange the tissue and remove more of excess skin, but try to keep most of your volume. Now, if you have a breast that's very, very deflated, right, and this usually is our massive weight loss patients, like patients that lose 100 pounds, 100 plus pounds, they tend to have what we call empty breast. And for those patients, then it would probably be beneficial to have an implant because we have to be able to bring volume back to the breast area. And the best way to do that is with an implant.
After how many weeks can you start belly button training after tummy tuck?
I usually recommend starting the belly button training at least 2 weeks after surgery, but if you do have any openings in the belly button, you should wait until everything is healed, because belly button training is basically putting either a marble or a silicone little ball in the belly button to try to shape it into a round shape, and also to avoid the scar to close down and the belly button to get very small. So you want that to be healed before starting to put pressure on the incision.
After tummy tuck, what would you consider to use on the incision to clean it?
So you don't necessarily need to put anything to clean it for the incision. So a lot of times, well, we use what we call steri strips. So these are skin tapes and they're going to be covering the incision, and they're typically on there for about 2 weeks. Okay, so you don't have to do anything to the incision itself. After 48 hours, you shower normally. Soap and water just hits all the areas. And then at 2 weeks, you can remove the skin tapes. And if everything's looking good, then you move directly to your scar cream, such as Silogen. And that's where you're going to be putting an incision at that point in time.
Okay, let's have another one. Are 10 massages enough after a mommy makeover?
Usually, yes. Like Dr. Earl was saying earlier, with a mommy makeover, the massages are not as important. They're important, but not as important as with a liposuction 360 or a BBL. Usually with a lipo 360, you should get more massages, maybe at least 20. But with a mommy makeover, usually around 10 massages should be good. Depends on everyone.
How soon after surgery can you fly if traveling?
Yeah, is that TikTok there?
Yes,
All
that's
right.
TikTok.
Hello, TikTok. So that's a great question. All right. So how soon can you travel? Well, you should be in the area at least 5 days post-op. So that the soonest you can travel will be 5 days after your surgery. Okay, not 5 days total. 5 days after your surgery. That's what's important there. Okay. So you're gonna come in, you're gonna have your pre-op, which is the day before, then you're gonna have the day of surgery, and then you're gonna have to be here at least 5 days after. So it's gonna make it at least a week. That would be the absolute minimum that you have to be in town for. All right, and then after 5 days, then yes, you can get on the plane and fly home.
Okay. Is there anything you recommend to help improve elasticity to the skin in general?
Fortunately, there is not much in terms of creams and topical agents that does a drastic difference. I think the most important is to try to prevention, right? Like keeping your skin from getting too damaged, and then the elasticity is harder to treat. So trying to avoid massive changes in weight, trying to keep a healthy diet, a steadier weight, and smoking also affects dramatically the skin quality, and that turns into the skin ability to bounce back and retract.
And the other thing is hydration as well. So you make sure you stay very, very well hydrated. That does help the skin in terms of its elasticity. And then there's things we can't control, right? As the older you get, the worse the elasticity gets. So unfortunately, there's not much we can do about that.
My breast is flat. Is it possible to get just breast lift with no silicone? Because I hate silicone.
So again, I mean, we would have to take your case, on an individual basis. So we can do that virtually. You can send photos. We can do that via video or in-house as well. So we have all the options. But it depends on two things. What are your expectations? And how much breast tissue do you have? Okay, so if you have some degree of breast tissue, then yeah, we can work with it. We can rearrange it, do the breast lift, and basically just remove excess skin and not necessarily remove any excess volume. Okay, so putting all that together, then we can make the right plan for you.
Do you do the client's desired shape, even if it is less natural?
We're talking about BBL, I
Yes,
guess.
yes,
yes.
it's about BBL, sorry.
Yes, I always have that discussion with the patient, right? Trying to see what are your goals, what are your expectations. But a lot of that, especially if it's a more unnatural look or more shelf or higher hips, it depends on your foundation. Because there's so much, like I explained, there's so much of the skin can be stretched on a one round or first round of BBL. So that is something I would discuss with you specifically when you come to either in the virtual consultation if you do that or in the pre-op appointment. We'll go over, that's why wish pics help a lot because sometimes when you're describing things, you describe it in some way, but then if you can show me what you mean, then I can tell you this is something that we can do, this is something that it'll take one round, maybe you'll need more than one round, or something that it's definitely with your body shape we can't achieve up to that level, and this is something that it's more a realistic expectation. So yes, definitely something I try to match my patient's expectations, but there's a limit depending on the body shape and also the elasticity and the stretching of the skin.
Yeah, certainly nowadays for like the more kind of what someone call more like a vixen looks with like a little tiny waist and relatively large buttock and hips nowadays, well, typically takes more than one round. Remember, back in the day, the people were actually placing fat purposely into and deep to the muscle, and so there's three spaces. You're filling fat beneath the muscle, into the muscle, and above the muscle, and so you can put in large amounts of fat, but of course that's extremely dangerous. We don't want to do that. So today we only have the one space that we can fill, which is between the muscle and the skin, that subcutaneous space that is a safe space, and of course we want to keep you safe. But if in order to get a certain look, it definitely may take more than one round to achieve that.
Okay, this is for the YouTubers.
All right.
Yeah, YouTube. Wait, move.
Don't
How high on the back is it covered in the Lipo 360? So how high?
Yeah.
It goes all the way up to here, basically.
Yeah.
So if you're seeing yourself from the back, draw a line like more or less at the axillas and like down below that, all of that is covered. If you are looking for liposuction up like below the neck area, it's called like the buffalo hump. That's an added area, but all below the axilla, all of that, it's included in Lipo 360.
Yeah, so pretty much like about 90% of the back is what we include here. So from above the bra line all the way down, and we do our best to try to get into like that lateral kind of breast underneath the armpit area as well. But remember, we got limits here in Florida, 4,000 cc's. That's as much as we can take out in one round.
For BBL, do you purify the fat for the fat transfer?
Do we fortify it?
Purify.
Purify it, yeah.
Purify.
So I was saying before, we don't really do much to the fat at all. So we don't centrifuge it, we don't wash it, we don't quote unquote purify it, we don't add anything else to it other than the antibiotics. So the main thing there is the antibiotics. So we do add antibiotics directly to the fat to minimize risk of infection. But other than that, we just kind of let it sit, we let it decanter on its own. And then the fat stays on top. All that, what we call, all that fluid is on the bottom. And then we remove the fluid. So we do separate the fluid from the fat. And then that fat's where we place the antibiotics and then transfer that fat.
Okay. If you lose weight after, will you lose the fat in your butt and hips?
So yes, it's very important that you don't lose weight, especially in the first 3 months after surgery, because that's when that fat is building the new blood vessels, and that's the fat retention that we're talking about, right? So if you lose, then that's permanent in terms that that fat that's there, it'll be there. But as any fat in our body will increase or decrease with changes in weight. So if you gain weight, like if you gain weight and your belly fat will get thicker, same thing will happen with your back. Or if you lose weight and you get thinner, then you lose fat in your buttock and hips. And also not in terms of just the size, but with gravity and aging, the skin changes and shape changes. So even though it's permanent, it is still attached to your lifestyle and keeping that weight. So the diet and exercise that we were talking about earlier.
Yeah. All right. Awesome, guys. All right. Well, I really enjoyed it. I hope you guys got all the stats, okay, out there for the world to see. And, well, so sad.
This is it.
This is it.
This is
the last
2022.
Hump Day. I believe yesterday was your last Tuesday tips.
It was.
Okay,
Yes, it
so
was.
that's it.
Yeah.
Last lives for 2022.
Yeah. We're wrapping up 2022.
We really, really wish everyone happy holidays.
Yeah.
We hope everyone has a great, great holiday with their friends and their family, surrounded by loved ones. Happy New Year as well. And we're all going to circle back in January
Yeah.
2023.
Yes.
That's right. Take care, everyone.
Bye-bye.
Ciao. Smile for the camera.
Wait.